everybody. Feels like it's a storm about to come through. So me and my daughter was gonna do like a little mukbang type thing and just, you know what I'm saying? I'm feeling better today. Today is now June the 10th. We waiting on our food to come, so it's always weird like that. It's like looks like a badass storm is about to come through. Let me look on the thing and see what's popping. Where's the let me look on the let me see and see what's going on with this. You got that from Pizza Hut for the wings? Mm-hmm. How many you get? Okay. Uh-oh, there it is again. Okay, Ashley. Go on, get that fan out the window right quick before the rain come down. Ooh. Why would they put that in my face like that? Just leave a little crate. Yeah, y'all, look. It's about to storm. Yeah, it just got dark all of a sudden, y'all. It just got really dark. You can see the clouds. Look at it. Yep. Something going on. I told her keep a crack like that. You know what I'm saying? She trying to make everything all covered up for us. So I have some cards right here in front of me, y'all. Okay, so let me pause and come back. Okay, I'm back now, y'all. Know this phone don't do the little flip thing while you still recording. So I'm looking at everything, and it's just getting really stormy. I'm actually so tapped in with the weather, I can feel it when it's drastically about to change. Okay. Okay, so let me see. I was doing the weather. Okay, Houston weather is saying that 40% chance. So it's probably going, but then it says 50% by 9 p.m. Okay, so we'll see. We'll see what it's going to do. 3 hours ago, and Click to Houston said Houston is back under a severe threat. Houston is back under a severe weather threat Tuesday with damaging winds possible. Is today Tuesday, y'all? Today Monday. So it's saying by Tuesday, which is by tomorrow. Yeah. Yeah. So I'm looking over here on my phablet, y'all. My phablet. You know what I'm saying? Checking it out. But yeah, today is June the 10th. My birthday was yesterday, Sunday, June the 9th. And I turned the big 50. And me and my daughter did a little thing here. I didn't go anywhere. Okay. I could not even get enough energy to get up and get outside. I need me a rollator. I need a rollator. Okay. That's what I need. And so for people that don't know what a rollator is, this is a rollator. I need a rollator. But I need it for big asses. You know, people with a lot of ass. Ooh. Wow. So this is what it looked like. But that one still look like it's tiny, right? I need something like that. So whenever I get super tired really fast, I can be able to sit. So what I was talking about before was on my video of me and my daughter watering the plants is having a herniated disc in my back. Okay, and that's what I want to talk about on this video because the weather been crazy. My ability to be able to put on, you know, clothing and get down the stairs and sit for long periods of time in a vehicle Not that long because the doctor's office is not that far away from these apartments. But when I'm going through this, I know the level of my difficulty. I know, so that's why I want to discuss. It's been called the pinched nerve. Um, I went to the clinic by LBJ Hospital. I can't remember what it's called. And that doctor, and I was having a lot of numbness. We had rented a car. This is a couple of years ago. We had rented a car. Was we already living here? No, we were still in the apartment 1904. And my legs was going numb while I was driving. It was very scary. So I made it there. And I took the back roads. I don't be getting on the freeway just because how that nerve can happen and it cuts off my legs. I don't feel them. So she diagnosed me with nerve root damage, lumbar something. Okay. So now I have to get that MRI that I never did get. Remember how that crazy weird ass shit started happening? I have to get that MRI. And so that's what the next thing that I'm trying to accomplish and do. I'm not going to use this video to talk about this apartment, what's going on with these housing people, and all of that. I'm not going to, you know what I'm saying? So anyway, herniated disc. Okay, so it says a herniated disc is a condition that affects the rubbery disc between the bones that stack to make up the spine. Spinal disc herniation, also known as a slipped or herniated disc, occurs when the soft center of a spinal disc pushes through a crack in the tougher exterior casing. A herniated disc can irritate nearby nerves and result in pain, numbness, or weakness in an arm or a leg. Most herniated discs occur in the lower back, lumbar back. Okay? Now, this is what I've been studying on, and it's scary, y'all, okay? So what are the causes? What are the causes? I'm going to go here to the clevelandclinic.org. It says the causes of a herniated disc. Okay. It says the disc have a soft gel-like center and a firmer outer layer like a jelly donut. With time, the outer layer weakens and can crack. A herniated disc happens when the inner jelly substance pushes through that crack. The leaked material may press on nearby spinal nerves. Okay, here are the reasons, the risk of developing a herniated disc. Aging, excessive weight, repetitive motions, sudden strain from improper lifting or twisting. So aging and excessive weight. So, but how many big ass people don't have this issue? Way bigger than I am. So these are the things that when you know that favor ain't fair. Okay. So the symptoms of a herniated disc vary depending on where the problem is in the spine. Symptoms will worsen with movement and they will get better with rest. That's why I'm always in this damn bed. Herniated or slipped disc in the back, which is called a herniated lumbar disc. Now, why didn't that lady label it as that? I guess because that's why I'm telling you that Lisa Danik over at the Northwest Clinic of Harris Health System knew what was starting to unravel in my back and lied. Because I'd already started developing the nerve pain in 2019. It says, it's common for a herniated disc in the lower back to cause sciatic nerve pain. That's why it's my left leg. My left leg. This is my right hand. This is my left hand. So this side right here be fucked up. And when it's fucked up, like really, really bad, I can't walk. You know what I'm saying? Like you need two legs to walk. So I can't walk. I can't, distribute my weight on both my legs if one of them is weak and falling. It says there's going to definitely be back pain, tingling, or numbness in the legs and or the feet, and muscle weakness. Okay? Pain near between your shoulder blades. Oh my God. That's why my shoulders be freaking killing me. I mean, killing me. If I'm sitting up here writing oracle cards, and that's why my shuffle be off. Like you don't realize how much you need your muscles in your body until something is messing up on them real bad. And you're not functioning like you once used to. Okay, so it's pain near or between your shoulder blades, pain that travels to your shoulder. Oh my gosh. Arm and sometimes your hand and your finger. So when I'm dropping shit, it makes sense now. Neck pain, especially in the back and on the sides of your, oh my gosh. Oh my gosh. When I be sleeping a certain way, my baby like, Mama, are you comfortable? When at the time I don't feel that lower lumbar pain. So I'm like, yeah. And then after a while I noticed that my is this side right here hurting right now. I be tight in a bitch. I'm like, what's that going on my neck? See? Pain that increases when you bend or you turn your neck. Yep. When I turn like this, yes. And that's why it's the weirdest shit, because when I lay on my left side, because I'll be feeling so much weird pressure, it's like the numbness and everything, and it feel like my left side is dead. So when I lay on it, it touches the nerve, wakes it up, and sometimes it can actually feel relief. It'll feel like a relief, like a exhale type thing. And then sometimes I can lay on it and it makes my head spin and I want to throw up. So I want to know, like, what nerve is it actually affecting? What's the nerves in the leg? So I think I need to actually set me an appointment for a neurologist. Okay. Pain that increases when bending or turning your neck and numbness or tingling in your arms. Yep. Mind you, I was diagnosed with rheumatoid, seronegative rheumatoid arthritis. Okay. Along with this stuff. So, how is a herniated disc diagnosed? That's the purpose of this video. So I can educate myself beforehand. Your healthcare provider will do a thorough exam. During this physical exam, your provider will assess your pain levels, your muscle reflexes, your sensation, and muscle strength. Your provider may also order tests such as a magnetic resonance imaging, which is an MRI. The most common and accurate imaging test for a suspected herniated disc is an MRI. So my rheumatologist already let me know that, she could set me up to go ahead and do that. But of course, when I first started seeing her, I was being assessed for the swelling, the itching, the damn discoid lesions, with all this shit. Okay? And still living in this situation. So magnetic resonance imaging, MRI. Now, it makes me wonder, why didn't Lisa Danik give me the order for MRI? Why? Back in 2019. X-rays. Getting x-rays helps rule out other causes of back or neck pain. I had x-rays. A computed tomography or CT scan shows the bones of your spine. Herniated discs can move into the space around your spinal cord and nerves and press on them. Herniated discs can move into the space around your spinal cord and nerves and press on them. A myelogram, it involves an injection of dye into your spine. I can't do that. I can't do the dye. So we understand that already. Okay? I cannot do a myelogram. Okay? It involves an injection of dye into your spine using X-ray guidance for a CT scan. The dye can reveal the narrowing of the spinal canal, which is called a spinal stenosis, and location of your herniated disc. An electromyogram or EMG, this test involves placing small needles into various muscles and evaluate the function of the nerves. And an EMG helps determine which nerve a herniated disc is affecting. So this ain't nothing to play with, and then having microtoxins that I'm breathing in and possibly fiberglass, because I already been and researched what that was all about too. In regards to the breakdown of the HVAC system and stuff that could be literally being pushed out through the volume of air that, you know, the animals, humans are affected by. Okay, so what can I do to relieve my herniated disc pain? Most cases, pain from a herniated disc can go away in time. This is what they claim. I don't see how. To ease pain while your disc heals, you can rest for 1 to 3 days if the pain is severe. But it's important to avoid long periods of bed rest to prevent stiffness. Exactly. Do you see how this can cause goddamn some kind of major psychosis? Right? Yes. It says get up and move around. So then once I do, there go that weakness and I feel like I'm going to fall. Taking over-the-counter pain relievers such as ibuprofen and apply some heat. No, because of this condition with my inflammation in my skin, having something too hot or too cold is going to put me in a tizzy. When should you see your doctor if your pain is interfering with your daily life? Symptoms are better after 4 to 6 weeks, and symptoms are actually getting worse and worse and worse. And this is the problem right here, how I know it's been in severe mode. You develop loss of bladder or bowel control. It's making sense. You don't mess with the spine. You don't play around with the spine. That is directly the center point of the central nervous system. You notice tingling, numbness, or loss of strength in your arms, hands, legs, or feet. You have trouble standing or walking. So, the best treatment is medication, anti-inflammatory. That's probably why the doctor, my rheumatologist, gave me that little muscle relaxing stuff. But I think that's counterintuitive, because if I'm already dealing with muscle weakness and potential fall hazards and, you know, passing out, literally just passing out, right? Why would I take something to exasperate that? That doesn't make sense. Why, if I have muscle weakness, would I take a muscle relaxant? Physical therapy. A physical therapist teaches you an exercise program to help relieve pressure on your nerves. Exercise loosens tight muscles and improves your circulation. Spinal injections. Basically the same epidural that I was given when I gave birth to my daughter. An epidural. A nerve block is what it's called. Or surgery. So in cases where you have a large herniated disc, might injure nerves to your bladder and your bowel. That may be what's going on with me. So it's called spinal decompression surgery. So yeah, I'm being motherfucking disabled in the wheelchair because ain't nobody cutting into my damn spine. It is what it is. It is what it is. This like I said, there nobody cutting into my spine. Nobody is experimenting with my spine. Nah. Okay? So I want to look at what a large herniated disc looks like. See if I can get some photographs. Google so damn nosy, you don't even got to finish putting the whole damn thing. They listening to you. You know, already put it up. I didn't say Google, what's da-da-da-da, and it already pulled it up. That's crazy. So images. Okay. And like I said, based on the fact of whatever could be going on in my, that nice breeze. They was talking about that clean, like cleansing of the air and the breeze. That's why I told them, put my damn window down. I gotta breathe. So, excuse me, this is what it looked like, y'all. So there's 4 words to explain it. Oh, and it's in the arthritis research and therapy. Okay. Okay, so this is called characteristics and mechanisms of resorption in lumbar disc. That's what she called. Yeah, that's what she had said. Lumbar disc herniation. But she said compression. She didn't say nothing about that word herniation. So it's called LDH, lumbar disc herniation. Can be spontaneously absorbed without surgical treatment. However, the pathogenesis and I'm sorry, let me get myself together. However, the pathogenesis and the physiological indications for predicting protrusion reabsorption are still unclear, which prevents clinicians from preferentially choosing conservative treatments options for LDH patients with reabsorption effects. The purpose of this review was to summarize previous reports on the LDH reabsorption and to discuss the clinical and imaging features that favor natural absorption. We highlighted the biological mechanisms involved in the phenomena of LDH reabsorption, including macrophage infiltration, inflammatory responses, matrix remodeling, and neovascularization. In addition, we summarize and discuss potential clinical treatments for promoting reabsorption. Current evidence suggests that macrophage regulation of inflammatory mediators, matrix metalloproteinases, and specific cytokines in intervertebral disc is essential for the spontaneous reabsorption of LDH. Boom, drop the mic. Yes. Yes. So therefore, accurate diagnosis of the disease to obtain targeted treatment is particularly very important, okay? IDH diagnosis methods mainly include radiographic examination, myelography, computed tomography, and magnetic resonance imaging. At present, MRI is the most effective. So that's what we're going for. Okay, yeah, the water coming down. That's what we're going for, y'all. That's what we're going for, okay? So that's what will be displayed here on my channel as I document my journey. Like I said, this channel is a documentary of my life, okay? Narrated by me through the Most High. Yeah, you know what I'm saying? Through my experiences, okay? In my revelations, in my revolutions, in my evolutions, okay? Okay, so there's surgical treatment for LDH and conservative treatment. Okay, so that's what it is. I got to get the MRI. They did. Okay, so what it states is the classification of LDH includes bulge. These are the 4 words. This is the way they classify it. Bulge, protrusion, extrusion, and sequestration. Uh-oh. Let me try to put this down a little bit more, y'all. Because it's coming down kind of hard. Uh-oh. My daughter ain't in here. As you can see, she ain't at her desk. I got to put it all the way down, child, because I don't know if it's because it's coming down in a slant. I don't know if y'all can see the rain. It's coming down in a slant. See that there? It's coming down in a slant. Mm-hmm. Yeah, let me go and get it in there good. Let me go. There we go. Let me just pull this down just a little bit. Okay. And yeah. All right. Okay. Oh. Uh. Ooh. All right, I'm back. Yeah, it's coming down. It's coming down. It's coming down. Oh, it's looking all gray and nasty out there. It's coming down. So yeah, y'all. So the one that's talking about extrusion and sequestration is the one that I'm very concerned with. And see, it's coming down, y'all. Whoa. And it's so crazy because on this, you really can't see really good. Oh, Spirit said, read this before I end this video. Spirit says, so like I said, the classification of a lumbar disc herniation includes bulge, protrusion, extrusion, and sequestration. Okay. Image from a 40-year-old female patient with LDH. The initial MRI showed that the L5-S1 intervertebral disc was hugely herniated. The center of the L5-S1 herniated I can't say that word. The center of the L5-S1 herniated intervertebral disc pushed the dural sac to the right. The right nerve root was compressed, and the dural sac was asymmetrically deformed. After 1 year of conservative treatment, the L5-S1 disc herniation was significantly reduced, the protrusion was absorbed, and the dural sac was not significantly compressed or deformed. So I feel like if hers was on her right, mine got to be on the left. Right? Does that make sense? Let me highlight this and see what information I can get. So I'm about to highlight L5-S1 herniated interval disc. Push the dural sac and then I'll write the rest. To the left. Copy. And I'm going to type it in. It got this damn spider on here. I'm going to type it in and I'm going to put to the left. Okay. So what I got was ooh, child, it's making sense. Yeah, so I'm gonna type on. I'm gonna click on this one from spinehelp.com. And this was updated as of October the 11th, 2019. Go figure, right? The L5-S1 spinal motion segment, also called the lumbosacral joint, is a transition region between the lumbar spine and the sacral spine in the lower back. And then there's like a video right here to go with it. Okay. In this, okay, let's click it.
The L5-S1 spinal motion segment, also called the lumbosacral joint, serves as the transition between the lumbar and sacral regions of the spine and the low back. This segment consists of the L5 and
That's
S1
exactly
vertebrae
where my shit messed up at.
And the anatomical structures connecting them. It provides flexibility to the trunk and low back.
Yep, that's where it is, y'all, right there.
Supports the upper body and protects the cauda equina and nerve pathways.
Mm-hmm.
The L5 and S1 vertebrae are connected in the back by a pair of facet joints that allow limited forward, backward, and twisting motions. Articular cartilage enables the joints to move smoothly, while muscles, tendons, and ligaments help hold the vertebrae together. A strain or a tear to any of these tissues can cause back pain and stiffness. Between the vertebrae is a wedge-shaped intervertebral disc that provides flexibility and shock absorption.
Mm-hmm.
The disc is made up of a tough outer ring called the annulus fibrosus,
Okay.
which encapsulates a gel-like interior called the nucleus pulposus.
Mm-hmm.
The L5-S1 motion segment provides a bony enclosure for the cauda equina nerves that continue down from the spinal cord. The L5 spinal nerve branches out from the spinal cord and exits on each side through the intervertebral foramen.
Wow.
It receives sensory information from the skin on parts of the low back, thigh, knee, leg, and foot. The L5 nerve also has a motor component that sends signals to various muscles in the back, pelvis, thigh, leg, and foot.
Wow.
Spinal conditions, including disc herniation or facet joint osteoarthritis,
Yeah, that's what I got.
irritate the L5 nerve and cause radicular pain, tingling, numbness, and weakness along the path of the nerve. If the cauda equina is compressed at the L5-S1 spinal level, it may cause severe pain, neurological deficits in the legs, and loss of bowel and bladder function.
That's what I'm going through. Yeah, so that's what I'm going through. It is making sense why I'm having the issues with my bowels now. And I'm taking, it's not really helping to take my oxy powders, the magnesium. Yeah, it's making sense. It's making sense, y'all. So that's what this video is about. I'm going to go ahead and, just pray that the divine timing works out for me to get enough energy to get up and get to the doctors. I mean, she could order me the MRI and I could just go. That may be the case. Okay. And we'll see. So it's time to get our little eat on. And we finna get our eat on. So I'm going to be right back.